Welcome, everybody. We're back for week 2 of the Health Wrap. This is an important program because this program takes all of that news that you're getting through the course of the week and really picks out what we think might be the most important things you want to pay attention to. And Karla has the first thing, right, Karla?
Oh, yes, Carolyn. Hi, everybody. You know, what was very interesting to me is reading the Washington Post, a story about young adults that have gotten COVID-19 and they have strokes. And what has happened in particular, there was one young man who was at home. He had been safe at home, enjoying time at home, and all of a sudden he couldn't talk and was debilitated. And what happened was when he got to the hospital, the doctor said he was stunned to see that he actually had COVID-19.
That's a story that a couple of people have emailed to me. So you really want to watch that. You know, we've so long heard demographics that we're older. It's looking like our young people also need to be very aware of what's going on. Well, the thing that I'm paying a lot of attention to, you guys, that parts of this country are opening up. And that means we need to be concerned. Because a couple of weeks ago, when we had the doctors on and we recorded the Docs on Call, our special for you, it's still on our site and you can check it out in its entirety. But one of the things that Dr. Hildreth said to us was he said, you know what, he's in Tennessee. He's the president of Meharry Medical College. And he said Tennessee might be doing a great job of controlling the virus, but if the neighboring states don't do that, as soon as we go back to normal, we'll be back in the same place where we started. And that's what he kept stressing was we need a national coordinated strategy. That hasn't happened. So we all want to keep our eyes open. We also want you guys to have some sense of what is happening all across the country. I don't know about you, cabin fever a little bit, but I'm used to traveling and being all over the world. So we thought, you know what, let's bring in as many of our colleagues, professional journalists who are all across this country to give you some sense of what is happening. And we're going to invite them in right now as we begin this discussion about different regions and different parts of the country. I just see the cameras popping up now. And
oh, look.
Hey, everybody. Thank you so much for being with us on this Saturday. I'll start with the woman in red. That's my girl, Dee Dee. Dee Dee Yadira Nassau, who is from Boston. Dee Dee did Centro, the show at WBZ when we were in Boston together. And yes. I asked her to come on because Boston, you guys are now holding this distinction of being number 3 with the most cases. So we're going to come back and talk about that as well. I want to welcome, for those who see that face and recognize that face from the what do they call it? The DMV these days, the District, Maryland and Virginia. Please welcome Derek Magenti, who's with us this morning or afternoon. Thank you, Derek. We appreciate it, and we want to hear what's happening in the district as well. Karla?
And also, we are going to talk with the legendary living legend, Betty Baye, that's joining us from Louisville, Kentucky. And everybody knows her in that area because she was at the paper for decades. And she is doing some independent writing now. And straight out of Michigan, we have Indianapolis. I said Michigan because she used to work in Michigan, Suzette Hackney. So people in Detroit, you remember her. But now, as you know, she moved on to Indianapolis, to the Star, and she is one of the people who is in charge of making sure the opinions and being engaged in the community. And she had an interesting article that we can talk about as we start talking about the numbers in our discussion today.
Sounds great. So Dee Dee, I asked you, were you aware that they're tracking numbers in Massachusetts? And you told me a couple of things that I just had not heard or read anywhere. One, that the first case in Massachusetts, the first fatality, was a Hispanic female there in Massachusetts.
At the Market Basket. First of all, well, I'm trying to connect the Docs on Call on Facebook, so it's no longer here, so I can't be able to share it now, correct?
Well, we'll put it up and then you can send it out to all your friends.
Perfect. Perfect. So, listen, Carolyn, I want to say hello to you and to our esteemed colleagues. Obviously, thank you so much for making me part of this so important, such an important conversation. Obviously, here in Boston, like you said, we're being, hit by COVID, and you were mentioning the case about the Hispanic woman who worked for a Market Basket, and she was the first, person who passed from COVID. And it's been very difficult here, and there are so many things that we're dealing with. You know, like I was telling you off camera 2 days ago, Chelsea, the city of Chelsea is the most, I mean, hardest hit city right now. Yesterday, we heard that Brockton also is, you know, also being very, very hit right now. But in the city of Chelsea, there's a lot going on. The mayor of Boston, Marty Walsh, said yesterday in his press conference, we want to make sure the Latino community understands that we're not going to ask them about their status, their legal status. You are going to be fine. Come on down, get tested, please, because he understands that they're not going to get tested, even if they feel like they have symptoms, because they're afraid. And he actually said that yesterday on his press conference. And I did mention to you as well the fact that Rhode Island, a lot of the cases are, you know, Latinos, and the governor there, Gina Raimondo, actually had to put together, just like Marty Walsh as well, a whole coalition of Latinos to find out what is going on. Why is the Latino community and African-American community, obviously, being hit so much by COVID? And I think we all know that. I mean, these are essential workers. And then also another thing is that the way they can't really seem to be able to, social distance themselves because of the way that they live in small apartments close together. The Latino community is also obviously the largest minority group, but the youngest and the fastest growing. So we have a lot of children, and it's been a very difficult process, even with school now being out. How can we ask our Latino parents to teach? A lot of the Latino parents have 2-3 jobs. So they themselves, a lot of them don't even speak the language. How can they teach their kids? It's already hard enough for a regular parent who speaks English to be able to teach their kids at home and become a teacher. It's already hard enough for us to do that. Imagine if you don't know the language, and imagine if you don't even know they don't even own a computer. A lot of these children would just do their work at home. And so there are a lot of different barriers, but language is definitely the number one barrier here for what's happening. And Boston, obviously, you guys know already, we're being hit very hard.
You've mentioned so many of the social determinants that we talk so much about so often with health disparities. It's not just the medical things such as high blood pressure, heart disease, asthma, diabetes. It's living in close quarters. It's having to be the essential worker that's on the front line. All of those things would seem to be contributing. Suzette, you're writing about this every day. What are you seeing in Indiana?
Well, here in Indiana, we were initially thought to be a hot spot, but things have kind of leveled off here. We have about 785 deaths and 15,000 positive cases. Of those, though, the troubling thing is that African Americans make up 19% of both the deaths and 19% of the positive cases, whereas we're only 9% of the state population. So you see that disparity there. The health department is making a concerted effort to go into some of these predominantly minority communities to do some more testing and try to get up to speed as to why this is happening. But we all know why it's happening. We just discussed there's a laundry list of reasons why it's happening in Indiana and across the country.
Suzette, could you talk a little about, you had a very interesting article that you had written about trying to get the numbers. And we know a lot of this is the numbers games. And we know that also we need those numbers because those numbers will help us in the future, not only just now, but in the future as well for underserved communities. Could you talk about the difficulty initially that reporters there had to get trying to get the numbers, and what does that mean for your area?
Absolutely. I was frustrated from the beginning, especially when I started seeing reports coming out of Michigan, where Detroit is, and Chicago and New Orleans, and all of these cities with larger populations of minority individuals. We were seeing how hard hit these communities were becoming. And so I started asking the question of our state officials, why don't we have a demographic breakdown? When you're telling us who's dying, you're telling us the age and the gender. We need to know more than that, particularly because on death certificates and such, that information is readily available. Our state just wasn't collecting it. And after pounding the table over and over again, they finally started releasing that information.
Thank you for pounding the table. We appreciate that. We really do appreciate that. Derek, what's happening in the DMV?
Well, you know, it's interesting. First of all, thank you so much for doing this. It's a fascinating thing, fascinating conversation. It's funny to me when you talk about the DMV for a couple of reasons. A, nobody who was born here calls it that, right?
Oh. I'm an outsider.
I know, and I'm making a little bit of fun of you only because it has become a little bit of a thing, right? People do say that now, but those of us who are from here never once called it that. We call it the metro area, we call it whatever, in DC.
Chocolate City.
Right, Chocolate City. And that was going to be my next point. According to the latest numbers, we've got in DC, just looking this up on my other computer here, we've got in the city proper 166 deaths, 3,700 or so cases. But the thing is, the city is still 45% Black, but 80% of those cases and deaths are Black people, right? So the disparity is great, for all the reasons we've all pointed out. I think you told me you saw that picture down at the Southwest waterfront where they had opened up the mart and people came and it was real crowded and nobody seemed to be social distancing. And that's a real issue. And they closed it the next day. And now when they've reopened it, it's been set back up for, with railings and so forth to keep people apart. And I felt like that was maybe an outlier. The way that thing is set up down there, it's kind of a outside atmosphere. It's like a, I almost want to call it a food mart or, outside kind of a thing. And people just aren't used to, you come to something like that, how do you socially distance? People aren't used to it, but they're doing it now. I think the bigger thing now is just the kind of jobs we have. I think that a lot of us are on the front lines. A lot of Black people are doing jobs that are not doable from home. And then you end up in a situation where you get sick. I will also say this, and this is, I guess, mildly controversial, is that in DC it's 45% Black. When I was growing up, it was 80% Black, but that's a whole different conversation. But there's not a lot of poorer whites here, right? There's almost none, and so that also I think affects who gets coronavirus, right? What's your income status? Where do you work? Can you work from home? Do you have can you afford to take 2 months off without going bankrupt? All these things come in together to see who gets sick and who doesn't.
Eric, I think you make a very important point about it does matter where you work. My brother's in Seattle, and he told me that he sees buses pass by with 1 or 2 people on those buses. Now, we know in New York, in Chicago, Detroit, and the buses and trains, because of the people being essential workers and the places that they work, those trains are still packed versus being in Seattle, which is basically a tech community.
Right.
Technology community.
I'm sorry. I wanted to make one other point, Carolyn, because you talked about the DMV and I made a little joke about it. But the thing is, you're right. It is one region, right? I mean, it's DC, Maryland, and Virginia. Those borders are completely porous, right? Everybody goes back and forth across them all the time. So the 3 jurisdictions have got to figure out a way to work together on this, because if one is doing something, the other's not doing it, and it doesn't do any good. So it's been interesting watching the mayor and the 2 governors try to figure out. And as far as like the numbers are concerned, DC's keeping numbers, based on race. Maybe Maryland is, but I don't think Virginia is. So it's really difficult to sort of line that all up. It becomes apples to oranges if you don't have that breakdown.
And as Dr. Hildreth told us, this virus does not respect borders.
Mm.
And the big concern is if you're in that region and you're still shut down, I can get on a plane here in South Carolina, because we're open for business, and fly to your region. And as we've said repeatedly, we don't know who has this virus. And so it's still in a spreading capacity.
Some have suggested, somebody said the other day, or maybe yesterday, shut down, travel, like altogether, like no plane travel for pleasure, just shut it down.
I think I did hear that, some of the attempts to cut the pleasure travel. I want to get to Betty. Betty, you're in Kentucky. I think when we talked the other day, you said they're at least you're starting to see tests in the community, because a couple I said to the doctors, you guys keep talking testing. I haven't seen a testing center.
Well, unlike many of Kentucky's statistics, our governor, because we had a decent election in November, has been very aggressive in shutting the state down. And our mayor here in Louisville has been very aggressive. And right now we have several sites that are strategically placed near the Black community to make sure that they are being tested. They have a whole testing going on today. They've worked with some of the grocery chains, Kroger, the drugstores, other places that are setting up testing. And we also have down in the Black community, they're gonna have 2 weeks of testing, Monday through Friday, and you don't have to show symptoms to get tested, and they can give you the results in 15 minutes. And so they have been really, really good here. And I think that the reason why our numbers are down as much as they are in the state and in the city is because we've had aggressive leadership. They shut us down when other people were still open, even a couple of weeks. I've been basically 46 days shut down. And I have family, you know, I'm from New York. So I have my sister in New York City. I've got my other sister who lives in the Atlanta metro area. You know, my sister was getting her hair done as long ago as 2 weeks ago or something. Wow. And with this, you know,
really?
thing that the governor's doing there, I've told my sisters and my families, and thank God for Mayor Bottoms in Atlanta. Even though my family's outside of Atlanta, Keisha is their mayor. So they've been sort of listening and saying, look, we are not going on. At my age, honey, I may be wearing a mask until 2021. I don't want to take a chance. But the tragedy is that even of the people who are dying, here in Louisville, for example, Black people make up 23.5% of the population, but we are 34% of the deaths that are going on in the city. Now, Louisville, you have to understand, is like an island in the middle of Kentucky. So we are sort of, more ahead than some of the other parts of the state. And this is where the largest Black population is concentrated. So I have been very impressed with the leadership here. I shudder to think if we still had Met Bevin, our former governor, still as the governor, we'd probably be unmasked and walking around and being sicker. So leadership matters. And I think that that's why our number of deaths, I think, in the state, now you got to remember the whole state of Kentucky doesn't have as many people as New York City alone. So it's about 3 million citizens here. So we have about, I think, 200 deaths so far, but I think it would be far higher if not for that. And also our governor's been real aggressive about healthcare. So people have been able to get their Medicare extended so they're not terrorized about how much it's going to cost to go to the doctor, because that is a factor as well, that people are afraid to go because they don't have the insurance and stuff to go, and they think it's going to cost them money. So I am where Kentucky usually is behind in most social statistics. I think in this case, they're doing a pretty good job.
I'm so happy to hear that. And there's some reasoning that we're doing this so that some of these leaders who might be watching this can take some of the ideals that are happening in other cities, such as that Dee Dee shared about Boston and being able to test everybody and setting it up in the community across the board. I want to show you one of our colleagues, Howard Ballou. Some of you all might know Howard. He's been out here for a long time. He's in Mississippi. And as you know, Howard and I kind of sit in this Bible, well, it's a Bible belt, but it's also a health disparities belt. And South Carolina is the buckle of that belt. Howard sent us a quote, and he said, African Americans in Mississippi make up 56% of the COVID-19 cases and 66% of the deaths as of last week. And as always, the health disparities are vast and stark, yet leaders here don't seem to see the need for expanding Medicaid. So Betty, your words were encouraging, because when you look at Mississippi, not too much better. I'll tell you, in South Carolina, our state epidemiologist said when it comes to death, more than half of the people dying are Black. And African Americans account for 56% of the deaths, while Caucasians are accounting for 44%. That's in South Carolina. So the health disparities are real. We need to know the numbers. We need to be doing some messaging, which is what we're really trying to do here, to tell folks. And I'm curious, in your communities, have you seen any kind of unique messaging that is effective? Because I feel like Mother Hen in the supermarket talking to the cashier saying, why don't you have a mask on? If they don't give it to you, why don't you make it? Go to the internet and figure out how to make it. But are you seeing any kind of unique measures taken in the communities that you live in?
Well, my sister in New York City, who lives in East Harlem, where we grew up, the supermarkets there and the other stores, it's like no shirt, no shoes, no service, no mask, you cannot come in the store. Now, people are still walking around here with flip-flops on and no mask and no gloves and touching stuff. I was in the Target the other day to get a foot spa because my feet look like Sasquatch at this point. But there were people in there with nothing on, and one man with a baby in a carrier and about 4 or 5 kids, and they were like at a school outing, going through the store, touching stuff. He didn't have a mask on, the kids had nothing on. And so even in the midst of the strictest, trying to be aggressive, you still have fools out here. And we have, a lot of this is Trump country here and Mitch McConnell country. So we are swimming upstream to try to do the right thing. And it's really, really frightening that there are people, and some of them have been demonstrating in the Capitol because they want to go back to work. And my thing is, there are jobs. You can go and work on the front line. You don't need to be marching somewhere. You can go and work in a supermarket. There are jobs. You can pick some lettuce, because the moment these people cannot get their lettuce and their apples and their organic fruit and stuff, some of them will take this more seriously, that the people that they deem not essential, particularly our Mexican brothers and sisters, because they're illegal or whatever, they are essential. And I think from this, at least they will realize that a lot of what we take for granted, the meat we eat, the food we eat, is because some Mexicans' hands touched it at some point in the field or in the processing plant so that we could eat. So it's so basic now. It's almost biblical. Like, let me show you, since you all don't seem to understand.
Well, I think it's interesting that Monday here in Tennessee, the restrictions will be eased, and they're going to ease into it. And so the governor, Lee, said, okay, Bill Lee, that we're going to start reopening Tennessee. However, the 2 largest cities here in Tennessee, Memphis, which we know that's heavily populated with African Americans, and they have like the highest cases here in Tennessee, and then also in Nashville, those mayors have said, we're going to have our own kind of plan. Yes, we will reopen things, but we're going to ease into it. There's a 4-stage phase plan that they have. Monday, you will be able to go into restaurants and sit down. However, it's going to operate at 50% capacity. Also, retail will open. Besides, we have the grocery stores and drugstores open. Other retail will open. And they also are saying only at 50% capacity. In order to move to phase 2, the Nashville Mayor Cooper, says that we have to wait 14 days. And he is going to go by science, not by dates, before he moves to the next phase. Now, this is also the same mayor here in Nashville who has Dr. Hildreth almost every day on television, and he's saying we're going by the science. And so he's following the scientists. I did notice too, when I was driving through an area where you see some of the salons and some of the beauty supply stores, I saw people outside cleaning. So that was a good sign. They had on masks. They're getting ready for whenever they decide to say, we're going to go to that next phase for salons and barbershops and that sort of thing.
So let me get this straight. If I'm reading this conversation correctly, Karla and I are in the serious, certainly I am, the belt buckle of health disparities. You all are not necessarily in the belt, but you're also not having conversations about opening up. Am I reading this correctly?
No, I'm going to tell you that we are having conversations about it, but it's very low key. The governor of Virginia, the governor of Maryland, and DC's Mayor Muriel Bowser have been everybody wants to open up, but they're all saying we're going to go by what the science says. We're going to take our time. We're going to be sure that we don't make things worse. That's been sort of the overriding philosophy. It makes me feel kind of fortunate, to be honest with you, to be in DC, because I feel like when they do open up, it may get worse, because I don't know if there's a way to avoid that, but it won't be crazy, right? And it won't be because we did something without thinking about it.
Manageable.
And if it gets worse here after opening up, the mayor said we will revert and we will go back.
Well, I can tell you guys, 3 weeks ago, Dr. Hildreth said this: if we open too soon, if it's not strategic and everybody isn't doing it at the same time, we're going to be right back where we started from. And by the way, he already said it's coming back this fall. Have we learned enough in this season of spring, have we learned enough to be ready for the fall?
That is why our governor, and it's been actually surprisingly so, he's been very conservative in his approach as far as opening things back up. He is allowing various industries to kind of come up with a game plan as to how they're going to approach this rolling opening. He is also being driven by science, he says. Now, I say it's surprising because he was Vice President Pence's lieutenant governor. And it's interesting that he has kind of moved away from what the administration has said, and he's had a lot of pressure. A lot of Hoosiers here have been demonstrating in front of the governor's mansion, saying we need to go back to work, this is unconstitutional, etc. And Governor Holcomb has been he's led through all of this unfrightened, and he says, I am not going to endanger the lives of people. I understand that the economy is hurting. I understand that people want to get back to work. I understand all of that, but science, we're going to be in a worse place come fall if we don't do this in phases.
You all do know that Georgia did open up yesterday, and
Correct.
not just open up more retail, they opened up bowling alleys, tattoo places, and they said you can open these things providing you do social distancing. So I just want somebody to tell me, how can you do that in tattoo shops and in bowling alleys, have social distancing? But everybody wants the economy. We want it to come back. All of us want it to come back, but you do have to have precautions, because what if we all start going back? Because it's like, okay, you can go to the restaurants here in Nashville. That's going to be one of the things, 50% of the people, but you have to go out, come in one way and go out the other way. So how is that going to work? Because I haven't seen too many restaurants that are going to let you go out the back door. So
I think the thing.
I have a question.
Go ahead, Derek. Go ahead.
I have a question. I just wonder, all of you might want to opine. How different would this be if we had more consistent, less self-contradictory national leadership on this?
Oh,
If you had a president who was saying one thing every day and drilling that one thing, and it was a scientific, direction. It made a lot of sense. Everybody kind of bought in, and even those who didn't buy in said, "Well, this will work out." Instead of we getting a different thing every day, inject some bleach, maybe. I don't know.
well, I will say this about Dr. Hildreth said that there should have been a national plan for all the states to be working together. And when we all close down at the same time and open up, I mean, like Carolyn said, these states, you can go back and forth between states. I'm in Tennessee, you're surrounded by the most states than any of the states, and people have to come back and forth. They live in different states. They live in Alabama, they come to work here in Tennessee. They live in Kentucky, some of them come to work here in Tennessee. Dr. Hildreth said, if every state, if leadership had said, this is what we're going to do with every state, it would have probably shortened this season.
well, I think it is clear that we are not going to get any sanity, I think, federally. I mean, that's the tragedy. I mean, if you even look at those press conferences, they are more and more insane. And the people who really know what's going on are tied up in the corner, having to nod to most ridiculous things like drinking disinfectant or whatever, the president said. It's rather sad, and we pile on him. And as much as I hold Trump accountable, I hold a whole bunch of people, Mitch McConnell, all of these people who have enabled the insanity that has gone on, the stuff that happened even before this, that made this even a bigger problem, because they were so busy trying to dismantle Obamacare. What is it, 60 votes or something to dismantle it. So a lot of the people, particularly in the South, couldn't even get the Medicaid extended. So now we have a pandemic and they don't have health care. And so you got the same people, and somebody said, I saw it today, I think on Joy Reid, where they talked about some kind of sinister thing. They think the Georgia governor wants to open up the state because he wants to diminish the number of people who qualify for unemployment insurance, because they've given so many tax cuts and stuff that the people, they want less people. So if your business is open, you won't qualify to get unemployment. And they don't want to have to pay unemployment to the people. So they're rushing the people back to work. Then you got the other people who are saying, look, this is like an African American thing, because they know people like to get their hair done and get the weaves and all of that. That's something that's very big in our community. Yeah, go out there and kill yourselves. And then there'll be fewer of you, and we won't have to worry about suppressing the vote. I mean, it's so sinister till it's diabolical. And I was looking at CBS this morning, and they talked about in the yellow fever pandemic in the 1700s, the scientists said that the Black people would not get it. They said the same thing then that we heard in the beginning, that, melanin, because we have melanin, we're not going to die from the virus. So they're pushing all kind of policies, and you hate to be so conspiratorial, but part of you feels like it's so racial, it's so ethnic, it's so nasty, and it's extension of what we've seen for the attacks on immigrants and other people, that it all fits together in this pattern that seems to make you think, this is a plot. So I think I would be happy if a lot of people in Georgia said, I think this is a plot, I'm not going to the hairdresser.
It's called personal responsibility, and Dr. Hildreth talks about that as well. We produce 6 public service announcements that we've been trying to push out as widely as we possibly can. And he basically says, we got to take personal responsibility of some of this stuff. You can be guided, and I'm not sure where they're going to take you, or you can make up your mind that you're going to do some things that will change the course of direction. But let me also share one other quote that just still sticks with me today. When we did the original show, and we had Dr. Georges Benjamin on that show, he said to me, Carolyn, there's a couple of pandemics here. He said one of them is a pandemic of misinformation.
Oh, Lord, yes.
And that in itself might kill us by getting wrong facts or following wrong information, following directions from people who ain't doctors, okay? That might get us in more trouble than the actual virus.
Well, that's one thing too that we want to talk about, is in where you live, are there signs of miscommunication given out to the community, myths and misinformation that people are seeing and believing in the community? I know when I was talking to my brother in Seattle, he was saying that he had Carlton. There's Carlton. He is at the Seattle Times. And he was telling me about what the governor had said there about information that's given out to communities. And basically, the Department of Health recognizes that communities rooted and led by organizations and groups are better positioned and equipped to listen, understand, and respond to the needs of their community. And he's talking about giving out information like what we're doing is culturally relevant way. That way that those people are better equipped to use trauma-informed lens, because basically they know how to approach people and they know what it's like with their intervention. So it's not perpetuating future harm and fear and distrust.
I don't think in this interconnected world that we live in, for the most part, is you have to be in one locality to get bad information. And I remember seeing the guy being interviewed on television, a black fella who was out on the street saying something about, I don't think black people can get this disease. Remember earlier people were saying that, and it made no sense at all. I don't know where he got that from, but that was kind of going around, so I think you have to be somewhat discerning. And that goes to your own point, Carolyn, about your own personal responsibility to say, wait a minute, that don't make any sense. Let's see if that's actually true, rather than just believing things.
Exactly. You don't have to be rude, but you do have to be rude. And if I know people who are not, you cannot come in my house. You even your good friends, when you know that they are talking foolishness, you cannot come in. I will talk to you through the storm door, because that is just something for their safety and for mine. And so this is the thing is you need leadership, but also you have to be unselfish. If you can commit suicide, if that's your choice to kill yourself, but you don't have an inalienable right to kill other people. And that's how I feel when I see these people talking crazy, like you said, Derek, or somebody that's saying stuff. I don't want them near me. You obviously, because if you're out there with no mask and no gloves, you're probably not washing your hands. You're probably not doing anything. But what gives you the right to kill other people? This is not a Jim Jones situation. Those people drank the Kool-Aid and they killed themselves. they kill themselves. This is something where you kill other people. And I don't think that homicide should be legal just because you want to breathe and cough on other people. And so
Do you want to jump in here?
Sort of interesting in this thing about your right, your freedom to come out of your house, but do you have the freedom to infect other people?
Don't be a vector. That's
Really?
Dr. Hildren said, don't be a vector. A lot of people, they're walking around without the mask and not social distancing, and then they go take their children over to the grandmother's house. And we know people
Yes.
who are elderly have a higher risk. And it's like, who wants to kill their grandmother? But don't be a vector and a carrier of COVID-19.
Dee, I think you're trying to get in here.
Yes. But I think it is so important. I mean, we've talked about so many positive things today just on this conversation, obviously, and this is why we need to have these kinds of conversations. You know, we're talking about terms discerning, we're talking about we need to take care of ourselves. We understand that at a federal level, a lot of things we wish they were different, but like we were saying, you know, here in Massachusetts, here in, you know, New England, I think they're doing a great job at making sure that we don't open up too soon. You know, New England has always been conservative, and we are being conservative again with this, you know, with COVID. And at the beginning, you know, talking about information, is the community getting information? It wasn't getting information, and that is why now so many in the Latino community actually have COVID. And now it's when the mayor and, you know, the governor of Rhode Island said, we really need to do something about that. I know Suzette had mentioned some statistics, and I wanted to let you guys know Latinos make up 16% of the state's population in Rhode Island, and 44%. Amazing. It has COVID in the Latino community. So that says a lot. But, you know, again, let's go back to what can we do? Yes, a lot more is being done. So definitely kudos to Governor Baker here and Marty Walsh here, you know, our mayor. And I think that overall, things are okay in the sense that most of us, you know, like Carolyn pointed out, most of, you know, the places that we're talking about, they are taking the precautions. They are, you know, there are some people out there, you know, like Meredith said, going around in flip-flops and doing all these things. You're always going to find that, you know. So what can we do, you know, ourselves? And, you know, and she was talking about obviously being selfish. We need to be selfish. We need to be, because we need to think of ourselves, but not just that, in a way, by not allowing our friends and even our family members, not just our friends, even our family members to come visit us, we are thinking of them as well. We're not just thinking of ourselves, we're thinking of them, you know. So I think that overall, this has been, you know, obviously a great conversation. It needs to continue. We need to continue to you know, hopefully we'll be talking about how the numbers are going down, how the curve is, you know, taming itself. So I think that a lot of good is going to come out of this, you know, that there's, in Spanish, you know, that there's a saying that says, no hay mal que por bien no venga, which means there's no bad that doesn't come for a good reason. I think a lot of good things are going to come out of this. You know, our earth is breathing and our planet is getting a break from all the damage that we've been, you know, that we as humans have been, you know, doing here on earth, and so many great things. People are coming together. People are learning the value of relationships. You know, they want to hug people again. They want to be able to meet. So love, you know, after all this is said and done, this too shall pass. And a lot of love is going to be there. A lot of people are going to be grateful for the relationships that they have and really cherish them.
Well, I'm hoping people hold on to these lessons, because I'm following the science again, y'all. And if the science is to be believed, it will be back in the fall. And so what we've learned through this process, we need to be able to be ready to apply, so that we're perhaps not in an extended, pronounced quarantine, but that we have some evidence that we can work on, or some lessons that we've learned. I promised you guys I wasn't going to tie up your whole Saturday, but you've been amazing, as we knew you would be. And you certainly have given our viewers an opportunity to see what's happening in other communities, and some ideas that I'm hoping some of the leaders that are watching will take and put in place in their communities, so that we can come out of quarantine, so that we can come out healthier, and so that we can learn some good lessons from this process. unless there isn't a quick final word, we're going to let you go and sign off. And thank you again for being with us. This has been fantastic.
I wanted to say just, we have a voice and we know other journalists that have a voice, and it's our responsibility as journalists of color to keep our community and the whole community at large safe. And we also want to encourage people to visit our Facebook and to watch our 60-minute town hall, because you'll get even more information from 4 very prominent doctors. So we want you to do that, and to tune in next week, because we will actually have some doctors on our show during the health wrap as well.
Absolutely.
And can I say just one last thing too?
Yeah.
I think that given the decimation of the numbers of journalists of color in many of the newsrooms, I think we ought to give kudos to our brothers and sisters like Suzette, the others that are still there in those newsrooms and still on the line, holding it down in the newsroom, and Yamiche, Alcindor, and other people are taking the hits for all of us to try to get some truth. And so I am really rooting for my brothers and sisters that are still in those newsrooms, being furloughed, not getting paid and still trying to do the work. I mean, to know that there are still people that think that the work that we did, that I did, and that we did, is that we do as journalists is still important. And though our numbers have been decimated in the newsrooms with the layoff and the coronavirus and all of that, to know that we have brothers and sisters, Latinos, Asians, Black folks still on the line, still working in those places, not getting any credit, but holding it down. And so I applaud you, Suzette. And I applaud my brothers and sisters, and they need to know that a lot of us, we're there for them if they need us, us old folks as resources. Maybe we know something that we can help out, in some kind of way. And so it is really, really important that we pay attention to what's happening in the media, to where our voices have been silenced a little bit, where, we need the ones who are still there, and we need to keep feeding them information like you, Carolyn, and Karla are trying to do with this production, to try to keep us relevant and keep our voices talking to the people, because I think our people still trust us. And so we have spent many years in building up the trust of our readers and viewers. And so if we get an opportunity to be out there, we need to do that. And again, people are being furloughed 1 week trying to work. They're working from home. I have friends who work for the Washington Post. They're not sitting home on vacation. They are working their behinds off trying to get stories out of Albany, Georgia, and some of these southern states. And if they don't do it, it may not get done, or it may not get done in the right way. So my hat's off to Vanessa Williams and Yamiche and a whole bunch of other people I can name who are out there still holding it down for our communities.
Well said.
Well, that's a great note to end on.
I wanted to say, really quickly, I think this is so important. I remember I spoke to you about this, Carolyn. Brigham and Women's Hospital here putting testing sites. This is so important. So if other states are watching, obviously putting up testing sites that, and saying specifically, you don't have to be a patient here. Anybody that comes can get free testing, and making sure that they let the community know that they're not going to ask them whether you are undocumented, whether you're documented. They made sure that they put that out in the news. And I think that is key. And I think some states could start putting testing sites, but making sure that if they want these essential workers that are Latinos to go, they need to be told you're not going to be asked about your status. So I think that is key. And I also want to say yesterday, as you know, Carolyn, it's only been a couple of months since I haven't been at WBZ, and I'm working on something else already. But I also produce the Encuentro Latino show, which is local, national, international. And just yesterday, we did an interview for our show that airs next week. We interviewed the Congressman Joe Kennedy, talking about how obviously the unemployment, how all of this COVID is affecting the Latino community. I don't know if you guys know that he's fluent in Spanish. So we did a nice Spanish interview with him, talking about what can be done now in the midst of COVID. And a lot of the small businesses obviously being affected here in Boston. Most of the businesses, minority-owned businesses, are are specifically Dominicans and Latino owned. And also, we also interviewed a doctor yesterday from Harvard Medical School, and they have a program. It's called Mentes Fuertes, Strong Minds, out of Mass General Hospital. And we were talking about the mental health. People are right now quarantined. A lot of issues are going to start coming up right now. What can we do? So that's something that you and Carla can touch on later on. Mental health is key. We need to address it now because it will be a bigger issue later on. So that's something, again, that I did yesterday, and that I encourage you guys to definitely look into it and try to talk about it now while it's, it's being created. A lot of things are being created right now.
And Dee, thank you for saying that, because that is something that is going to be coming up. We're going to have Dr. Sherry Blake, and we're going to have some other therapists and psychologists and psychiatrists talking with us, because people are anxious. People at home and outside.
A lot of depression is going to be coming, a lot of different feelings. And so we should deal with that now.
Dee Dee, you're a blessing to Boston. You all have been a blessing to us today. I thank you for your time, for your voices, for your expertise. I know those who have followed you for years are going to be looking and excited to see you again. And I hope they get this messaging. But thank you from the bottom of our hearts this morning for being with us. Thank you, guys.
Great to meet you.
Everyone.
Thank you. And so, Carla, as we prepare to wrap up this week's Health Wrap, you mentioned that we'll be talking to the doctors next week and looking at mental health. We'll also be talking to some doctors on call. We'll be answering questions. We apologize for technical difficulties that didn't allow our audience to get their questions in, because we do like interactive conversations. I know we usually like to leave on a high note, and people always used to tell me when I was in television news, y'all never have any good news. You never have any good news. You got any good news before we get out of here, Carla?
Well, I want to give a shout out to Essence Online, because in light of the situation with COVID-19, they were having a virtual business conference, and there were several women who were able to, and people are concerned about their businesses right now, several women who were able to receive awards with large sums of money to continue their business. In the process of that, they also did not forget about self-care. So if you go to their website, Essence Online, and then you'll see they'll talk about business, but they are also talking about self-care.
Well, it's interesting you mentioned that, because one of the stories that I saw as I think about it this morning, and I've been wondering this in the back of my head, story about Boeing, which is also here in our backyard in South Carolina. They have a facility, but they also have a couple of facilities up there where Carlton is. And one of the things that I was impressed about is that they've made the decision that they're opening back up and workers will be going into these plants, but they have thought through a safety process, and that those safety protocols include everything from the face mask, starting with the temperature, taking your temperature before you come in the building, and then having the face mask, having the gloves. If you're less than 6 feet beside someone, then the next protocol is that you have the PPE. So bravo to Boeing. If you're going to open back up, and all of our businesses should think about being socially responsible and doing everything they possibly can for the workers as they return back to work. Carla, as always, it's a pleasure to work with you.
Hey, friends.
Hopefully we've saved a couple of lives this morning. We want to thank our sponsors. You see them on the screen there. National Conference for Health Disparities, or to eliminate them. We were supposed to be having that conference this week. Meharry Medical College, our environmental justice friends. And then we'd like to welcome the Primary Health Care Association here in South Carolina. They're joined us, as well as Hands on Health. And then we have an official media partner, and that is Millennium Magazine on the internet. We thank all of them for being our partners and supporting Doctors on Call and the PSAs, the hour-long show, and of course this Health Wrap that we're doing once a week. It's a pleasure.
It's a pleasure. Stay safe, stay alive.